all for joining us to have a candid discussion on COVID-19 and the effects it has had on our families and our community. We are joined this evening by Elise Clinton, the owner of Minefield Grill. Good evening, Elise.
Good evening.
We also have with us Pastor Andrea Johnson of Family Fellowship Church. Hello, Pastor.
Good evening. How are you all?
Good. We have also Dr. Michelle Mulraney, who's the president and CEO of Taylor Medical Center in Jackson, Tennessee. Good evening. We also
Good
have,
evening.
okay, we have my son, David Johnson, who's a graduate student at the University of Chicago. Hi, Dave.
Hi, Mama, and good evening, everyone.
Good evening. And we have with us Tina Prescott, the Chief Operating Officer of West Tennessee Healthcare. Good evening, Tina.
Thank you. Good to see you.
So tonight, we want to frame our discussion about the impact that COVID has had on Crockett, Haywood, and Lauderdale counties. And we want to hear some statistics. This past Tuesday, we reached the grave milestone with COVID-19 deaths crossing over 200,000. And in Health District 82, we have lost so many citizens, families, and friends and coworkers. So right now, let's go ahead and have a good discussion about this. Ms. Clinton, let's start with you. Hi there. Can you tell us how COVID has affected you personally, please?
I was tested and had a positive COVID test in August. I own a restaurant. I have closed. I closed for the month of August. Another lady that works with me, she was also positive. And so we quarantined all of our other employees, quarantined for the 14 days because we work very close. And fortunately, no one else was affected. And I actually had a much lighter, milder case than the young lady that works for me and did not have to go to the hospital, fortunately. Had some dear friends and my mom dropped some hot food on my porch and leave and then call me because everybody was afraid to be around me. So it's even getting over it. It lingers and kind of hangs on, and you feel good, but you still have that lingering exhaustion.
Okay.
It's affected my business in a, of course, negative way as anybody in small business right now.
Mm-hmm. Mm-hmm. Okay, so I'm glad to see that you're doing well now.
Thank you.
Pastor Johnson, can you share with us your experience and how it affected even your church? I can't hear you, Pastor.
I'm sorry, I was on mute. I'm sorry.
That's okay.
So yeah, I was diagnosed or tested positive July the 14th, and what we was already in quarantine as it relates to the church. We was doing virtual services
Okay.
anyway, especially at the end of June when we saw the spike was going up. Mayor Rawls have and the health department have already been putting out memos with the numbers, and so we decided as a church to go ahead and go virtual. During that virtual time, um, I tested positive for COVID. Since that time, I'm like Miss Elise. It have the effect that it have on me, just getting your energy back. I think most of what we do is serving people, and so when you dealing with people and you can't perform at the capacity and at the energy and the strength, it psychologically drains you as well, not just a physical thing, but mentally. Uh, when you can't serve at the capacity in which you are used to serving at. And my family was quarantined. I was the only one in my household that tested positive. Everybody else had a negative test. Uh, However, that quarantine part, it was a plus and a minus. So I could say I can say the plus is I got rest that I didn't think I would
Mm.
ever knew what rest was. I thought sleeping was rest, but actually, I would. So the minus part of it is because of the fact I couldn't perform at my normal duties and couldn't get out to do what I normally would do as a pastor, as a leader, and as a community advocate. So that was the depressing moment,
Mm.
and it still have a gravitational connection to it. To it pulls you down from time to time, and you have to just be encouraged and share your story like you're allowing me to do tonight, which encourages us too. And I've had several family members, relatives that passed uh,
Mm.
during this time too, even after I had tested positive, and I oftentimes reflect back and said that could have been me. That could have been the
Mm.
COVID could have done me the same way, and I'm blessed and fortunate to be on this live stream tonight talking to you.
Well, we're so happy that you're here with us, Andre.
Yes,
Uh,
ma'am.
Dave, now you have kind of a special and rare case. Can you share that with us tonight, please?
Yeah, yes, ma'am. So I called it twice, or at least on paper, I've called it twice. Once in June, I visited South Carolina with some old teammates and did some careless stuff. Obviously, we went to like a bar and no one had on a mask, and you kind of think to yourself, maybe the people who would have COVID probably stayed inside the house. They wouldn't come to a bar, and that's probably the dumbest thing to think in thinking that. So I kind of learned my lesson from that, and started to recover probably within the next few weeks. And then come August, I catch it a second time um, from my grandparents, and I knew when I caught it because I had a similar feeling. It wasn't as bad as the first time I caught it. The first time I caught it, I was definitely tucked up in my bed, feeling all of the symptoms, and just kind of scared because what was to happen of the virus was still unknown when you caught it. But the second time, I was like, "Yeah, Mama, I kind of feel that I have it this time." But it wasn't as bad. It just kind of was a weird feeling. I still kind of had some symptoms of um, maybe mucus or like a runny nose or just feeling warm, but it was nothing as bad as the first time. And then within a few weeks, I was able to recover as well. I still have had kind of lingering effects, maybe with itching or maybe headaches, but nothing as bad as how I had it when I was positive. So I'm really fortunate that I didn't get it as bad as some of my peers or some of my family members, and just thankful that I was able to make it and be on this call tonight, and thankful that nobody else in my household received it.
And we are very thankful about that, David. So we do recall when David got it, he was in quarantine. I mean, we had to stay away from him, and it affects people in so many different ways. So my husband, who is an essential worker, because David had it and he was exposed to it, being around Dave, he could not go to work for several days. We both had to quarantine. We couldn't go around people. And, we're still learning so much about this virus. But the main thing is we did not want to take any chances that we could pass this on to someone else. And that's why we are so serious about wearing our mask. And Dr. Mulraney, maybe you can come in now and kind of tell us things that you've seen and give us some recommendations about COVID, please.
Okay. Yes. Thank you, Andrea. The things that I've seen with COVID early on, we were just learning what this virus was about. And I do remember someone asking me very, very early on, and I said, well, the coronavirus caused the common cold and you can get over it. But as we were learning, this virus has mimicked a lot of different things. So if you have an underlying health condition, it tends to affect you um, a lot more than just having the cold symptoms. So um, it may turn into a pneumonia and you end up with respiratory distress. Some people have developed blood clots in legs or in their lungs. We have seen just some type of atypical rash, and that being linked to COVID. It affects the heart. It can affect the kidneys, but this COVID virus can affect basically different organs in your body. But what we've seen is that if you have an underlying health condition such as the hypertension or diabetes, asthma, it may affect you a little more harsher than the rest of the population. And what I've tend to tell my patients is, okay, we have to manage your blood pressure. We have to manage your blood sugar. We need to manage your asthma. And early, and then it morphed into, well, we have kids that are coming in, and a lot of parents don't think that they're carrying COVID. Kids may not be affected, but what I found is, yes, those kids are affected. They may be asymptomatic. They, not expressing symptoms, or it may be just allergy symptoms. But when I end up testing them, I found a good deal of my kids did have COVID. So what I'm seeing is the kids are bringing it back into the home. So they're around the parents, they're around the grandparents. And then that's how the COVID is spread easily. And then the parents or grandparents have a serious, medical complication from the COVID and may need to be hospitalized. So I kind of see it, right there at the very beginning stages, and have to make a decision whether or not if this patient needs to stay. Well, actually, yes, they stay home quarantine, or whether or not I need to refer that patient on to the emergency room, especially if their, oxygen level drops or they're having very severe expression of this disease.
Okay.
So COVID has been one of those diseases. Go ahead.
So, and I'm sorry, and I know that, you guys are still learning about the virus, and it's interesting that you are talking about smaller kids that also get it, and so many people are asymptomatic. So that's the scary part,
right,
because they are little
right,
carriers, and they don't feel anything, but they can pass it to their loved ones or whoever they're around. And so that's what
right,
scary.
Right.
So I guess if a child gets it, they don't know it, they could take it home.
Right.
Then if
right,
grandparents become ill, they're tested, and then I guess they have to test the child at that point, because everybody usually in the household needs to get tested, and that's when maybe you can find out that the child has it. So, it was at first believed that it was only older people. It was at first believed that it was African Americans, but we know that it does not discriminate.
Right.
It does not discriminate. Now, in the beginning, they kept saying it affects African Americans more, Dr. Maraney. So is that what you have seen in your practice?
You broke up for just a minute. You say in the beginning?
In the beginning, they were saying how it affected African Americans more than anyone else.
Right.
Do you see that as well?
I see that as well in my practice.
You do?
Well, yes, my practice, I do. I do.
Okay.
I do have a lot of African American patients, and my African American patients. Well, the population of patients that I see, I have a large population with chronic illnesses. So I see a lot more of that. And, it's been devastating for me because I've had patients who have, passed on from COVID, and, I'll see them a couple of weeks or a month, and, the next month I hear that they've been in a hospital and they have died. And that's one of the things that I have to process through as a healthcare professional, because it's like, oh my gosh, did I do everything possible for that patient?
Mm-hmm.
Did I, was I able to, find out in time? And a lot of times that's one of the things that is high on my list when they come in. If they have a sniffle, if they tell me they have a sore throat, or they think, oh, like I said, it's my allergies. It's like, let me find out, because we got other, you got other things that are going on. I have patients who've had heart stents and thinking that they're doing well at one point to, be affected, with the COVID. And a lot of times I have to go beyond, those questions that we ask. Do you have a fever? Do you have cough, congestion? Do you have a sore throat? When I was asking patients early on, have you been out of the country? Most of my patients have never been out of Tennessee. So that didn't even apply.
Right.
But the thing about it was, there are some people who I started asking, have you had members that you have come in contact with who have been out of the state? Have they been to Florida? Have they been to Louisiana? Have they been to New York? And then that's where I started to find a lot of information. We got people who are traveling, not necessarily out of the country, but I had, my teenagers coming back from spring break. That's when, we were first learning about things. My own children were on spring break in Florida, and they came back. It's like, okay, you know what? We're gonna have to quarantine you, and knowing that I have 2 teenage sons that I could not keep still.
I know.
Keep their children. I'm sorry. Not children, their friends. I'm referring to their friends from, moving about. Like, okay, guys, you guys need to stay put. But I know they want to go over each other's houses. And I remember at one time when we were, strict quarantine, I had to make that decision. It's like, you know what? Please do this for mom. I have to go to work every day. So please, 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 we can have people over the house. I'm sorry. We cannot present, but
it's something.
That's what they wanted to do.
Yeah. It's something about the young folks. Sometimes they don't always want to listen to mom, right, Dave? So we just have to pray for them and hope they will learn and learn their lesson, and just and hopefully we will not have any long-term effects. Ms. Prescott, can you talk to us about the statistics for Crockett, Haywood, and Lauderdale County and what you're seeing as well, please? Thank you.
Absolutely. I do want to start with the state, and just to make sure that we put it in the context of Tennessee remains in a red zone for our nation. And that means we have greater than 101 new cases per 100,000 population. And so when our government looks nationally, they still classify our state as a red zone. We're the 9th highest in the country with Tennessee. So when we look at all the counties, to get to your to the counties that we serve and then that are in District 82, when we look at those counties, 15% of the counties in Tennessee are classified with high community spread. And so of those, Haywood and Crockett are both red counties at this point in time. So that means they have a high rate of community spread. Lauderdale is not. But if we look closer to home, to the patients that we care for within our healthcare system, we are seeing today, we have 104 patients across our system that are hospitalized with COVID. There's about 80, some of those they've been with us for many weeks, and they're already testing negative. So they're past the COVID infectious stage, but they're still so sick. To what Dr. Moraney was talking about is the pneumonias, it's the respiratory distress, it's those clots, it's so many, their kidneys are injured, their hearts are injured, from this virus. And so They remain hospitalized for a long time. So 87, though, across our system, there are 87 positive patients that are hospitalized, with 75 of those in Jackson and 10 in our Dyersburg hospital. And those two hospitals have taken care of the majority of our COVID patients because they have ICU capability, larger ICUs. Our other hospitals across West Tennessee, Bolivar, Camden, Milan, and Martin, they have taken care of those patients as well, but just not as in those higher numbers like Dyersburg and Jackson. We have 25 patients in the ICU and 19 patients on a ventilator today. And those numbers, while are definitely, they've come down in recent weeks just a little bit and plateaued. We're watching, though, preparing for what we will see as a second surge that we are going to plan for, and then hope and pray that we don't experience that. But our hospitals, all of them, have to be ready to serve all the patients across West Tennessee. Sadly, a lot of our communities do not have a hospital in that county for various reasons. Healthcare has been hard in the rural community. It remains difficult to operate hospitals in all communities, but we're there. We want to be there for West Tennessee and have different kinds of healthcare services for our communities. And we stand ready in our Jackson Hospital to provide that highest level of care. So our ICUs are full, our beds are full, and we're working with those patients to get patients to that next level of care as quickly as we can and care for them in the best manner we can. So we have a plan of how to take care of even 200 COVID patients, where we will put those patients, both ICU patients and floor patients, what the impact will be on our other services. You can't just, COVID is what we're focused on discussing, but there's a lot of other patients that are so sick that may have delayed their health care, or their healthcare procedures may have been delayed because of the elective surgeries that were, at the beginning of the pandemic, the governor, shut down all elective procedures across hospitals. And so there were people that there was a backlog of procedures, surgical procedures, and other kinds of procedures we needed to catch up on, which we're working through as well. So from a healthcare standpoint, we are, just kind of, it's a day-to-day planning, day-to-day working through how we best serve those patients and make room for everyone. Lots of teams of people doing that I'm very thankful to work with every day. Tons of providers across all of our communities, like Dr. Moraney, that are taking care of these patients in the clinics and doing a wonderful job. And then we want to be there when her patient needs hospital care. No matter where they are. Okay. We've also tried to utilize some new technology through this pandemic and are able to monitor some of our patients remotely in their homes. So when they get to a certain point, they're ready to go home, or we think we feel safe with them going home, we can remotely monitor those patients. We've been successful with that, and I'm very proud of that technology. You got to utilize the technology like Facebook Live to reach people, and so we're taking care of people outside the four walls of the hospital. And my philosophy is we don't waste this crisis, and we learn how to thrive, not just survive during this pandemic.
Well, I tell you, the year 2020 has been one heck of a year. And we are all still learning, and we are still praying that we will finally get this virus under control. We should be able to get a vaccine, I'm hoping, very soon. And I remember you saying, Tina, that Haywood County and Crockett, we are still in the red zone.
We are. I don't mind sharing, of our hospitalized patients today that I spoke of, we have 3 of those our current patients are from Haywood County, 2 from Lauderdale, and 4 from Crockett. Throughout the course of the pandemic, we've been watching these numbers the whole time. We've cared for a total of 42 patients from Crockett County. We've cared for 39 Lauderdale County patients and 67 Haywood. So that's a little bit of a jump on those Haywood numbers. We've seen some higher rates of transmission and hospitalizations from our Haywood County area. And sadly, we've had 8 deaths of Crockett County residents, 8 of Lauderdale, and 15 from Haywood. So that's where, this does hit us personally. Listen to the stories. It's a personal loss for a lot of us throughout this pandemic. And we care about these communities across West Tennessee, and we want to be there to take care of you, but we want to encourage everyone to mask, to social distance, to hand sanitize, take those precautions. Healthcare is for me, and taking care of patients. It's not political. It's about public health. It's about public safety. It's about keeping each other safe and wearing a mask to protect the others around you.
Well, and I'm glad you mentioned that about the mask, because it appears that it had become a little political, in which I couldn't understand why. They said that masks will slow the spread. So I don't understand why people have a problem with doing that, because you could be asymptomatic and spread it to someone else, not knowing that. But if you had your mask on, then we wouldn't have to worry about that.
Yeah, we know from the research we've done and the CDC guidelines that we follow that if early on, if I'm masked as a nurse and my patient is masked in the clinic, if we're mask to mask, there's a low risk of transmission. It's even lessened when we have on a face shield. And so in our facilities and our hospitals, we do use face shields and regular isolation masks as we care for any patient in our facility. Because of that asymptomatic spread, you do not know. We test our patients, but families come in for our non-COVID patients and visit. They could spread it to that patient that's in our facility. So we try to protect our staff. We try to protect our patients by taking extra precautions with our personal protective equipment.
Okay. Pastor Johnson.
Yes,
Hi.
ma'am. Yes, ma'am.
So now, have you seen or have you shared your experience with others?
Yes.
Okay. Make sure that everybody kind of has an understanding of
Yes.
virus. Okay. Good. And with your church, you said you guys are still doing it virtually?
Yes, ma'am.
Still doing it virtually right now?
Still virtual.
Okay. And Elise, you are open, but only limited. So as another small business owner, I know COVID affected us also. Can you share with some small businesses some things that can be done to assist them?
Well, we have always done a large carry-out business. I don't know about any other businesses except for the food, but we still are doing quite a bit of carry-out, and we don't even have the guests come inside. A lot of our customers will open the back, if the back of their car opens, and put the money back there, and all we do is just put it in the car and take their money. So there's no person-to-person contact. And we have increased that part of our dining experience, but we still, just like we're talking about, we still have people that come in and sit in a group, and none of them have a mask on. Our county doesn't have a mandate. And the same day that my coworker and I were feeling so bad and we had our masks, they said, "You don't have to wear those. They're not going to keep you from getting COVID." And I thought later, well, thankfully we were still wearing them, because we fed their, we prepared their food, we carried it to their tables, we refilled their drinks, and thankfully none of the group ended up catching the virus, because both of us unknowingly were there that day working with it. So protect yourself and protect other people is the main thing. Because you don't know, just like you said, you don't know who has it and has no symptoms at all. She and I both felt terrible. We had symptoms, but we just thought it was just a cold, and we made our appointments to have our test that day. But I mean, it was, the fact that they still want to come in and just, I'm thinking that doesn't really get it. That doesn't, you're just
Right.
rubbing that germ right up in your face. There's something about the mask for a certain, and I don't even want to say age group, but it is kind of a group of people my age, and they're just kind of like, and I'm like, yeah, I'm not playing with it. I don't want to have it again. But they just don't really seem to, they just don't seem to understand. And I tried to be very transparent when I did find out I was positive, and immediately closed. And I had some people complain. They said you should have closed before your results were back. And I said, I gave them the dates. I had been out of the building for 5 or 6 days before I knew. But it wasn't worth playing with anybody else. I have a guy that works for me. He's worked for me for several years. He has asthma. It wasn't worth any of them being around me until I knew, and it wasn't worth their families having it brought home. And so we took a very quick stand, and we closed before because we had been infected. One of us had been infected, which would have, had we been positive, would have in turn affected the other 5 or 6 people working, and we had to close before. So I think people, even if they don't believe, in the protection they need for the virus, they're going to be really surprised in the next, 6 months that they lose a lot of things that are in their town that they, they're not going to understand. Well, why'd you close your business? Why did you do this? Well, there was no option because financially, the financial effect of the virus, and, we have probably been closed 3 months of this year. First, when the mayor shut everything down, which I'm totally, the governor, and I think that they should have kept the places closed longer to keep it. As soon as we opened, we were packed. It was like nobody had any concern for. It's just a missing link there where you've got a group of people who just are just like, kind of like playing like it's not there. I know right now 5 or 6 people in, different hospitals with underlying health issues, and the same thing. They come to eat on a Friday, and then the next thing you know, on Monday they have COVID and they're in hospital. It's just like, if you feel bad, stay home. If you don't risk passing it to other people, knowing or unknowingly.
So, Dave, can you tell us, are you still experiencing some of your related symptoms to COVID?
Kinda. Definitely not as much. I'm just starting to breathe normal again.
Okay.
I think I gotta give a lot of a shout out to Dr. Moraney for that help. But yeah, I'm just starting to breathe normal and begin to work out again. I haven't exercised in 3 or 4 months since June, just because 1, I didn't feel right, and then 2, I didn't want to go back into a gym and I could possibly expose myself to others and get everybody sick. And it's crazy because I guess coming to Brownsville, I thought, this is the last place that I would catch COVID or come in contact with anybody who has COVID, because, we're such a small rural town. Maybe Nashville or Memphis or Chattanooga would become a hotspot, but not Brownsville. I didn't think that if one person catches it here, it could spread around and then everybody has it. But back on the subject, those are the only symptoms that I've still had. Something small, maybe like a headache or breathing, but that's slowly but surely starting to go away.
So, Andre, have you started doing anything differently now since you were diagnosed and recovered?
Well, I think I'm just being more attentive to what I touch, how often I wash my hands, just making sure. The masks now have become like when you leave your phone somewhere, you tend to, adjust things and adjust your wardrobe to become a part of your clothing. And so I think being more conscious about it, making sure that I have all the necessary cleaning, sanitation, because I do have a essential job too. That I have employees that actually work, and we want to make sure that they are they have the right tools and things with them to make sure that they on their job can be healthy as well. So I think it's an eye opener. I do. I mean, I've been around people who have had it. I would say not around them, but I've been around families that have had COVID. I've been around families who have lost loved ones, and you try to console them and try to help them understand how important it is. Just with the culturally we do repasses, but how important it is. Hey, don't gather. Don't try to do anything to that was used to be normal. So we got to look at this thing a little bit different. So education is a key. It's a must. It's an ongoing process because I think everybody's getting to that point to they just getting tired of being controlled by this thing, and so and they kind of like getting more relaxed in certain times until it hit home. And I hate for it have to happen in to that magnitude before we become an advocate for it. So I think we need to make sure that we pay attention to the CDC, pay attention to what we're hearing tonight, and especially from the nurses, the doctors, and pay attention what's going on. It's real. I think a lot of time we don't take it as that, but it is definitely real.
It is real, and anybody can jump in on this one. What do you think is our best way to combat all of the misinformation that's out there? Like, what do you think we need to do? We hear so many strange things. What's the best way to combat all of that, Dr. Moraney?
Okay. Okay. Well, I think that if we just adhere to the guidelines, where wearing a face mask is best, washing your hands frequently, keeping your hands out of your face, and social distancing. If we just keep to those guidelines, I think that will help us to decrease the spread of COVID. And all this other stuff that we're hearing is like, let it go in one ear and out the other. The mask is the way to go. I know we hear a lot of I hear a lot of patients that may say, well, I can't wear that mask, I got a breathing problem. It's like, well, if you're 6 feet under, you're really going to have a breathing problem, because it's no joke. Wearing that mask is really vitally important.
In the correct way. I mean,
And letting all that other stuff go.
you go to the store, you go to the grocery store, and their mask, the store's masking, their employees have their mask down here, and I'm just like, I got to get out of here. I'm gonna have it again. I can't stay. It's once you've had it. I mean, guys, y'all know you're gonna be. I mean, I'm more careful than I was before because I don't want to have that again. I don't want to have to tell my kids that live out of state, oh, by the way, I have COVID, and then because we go to the worst place when we hear somebody has it, we go mentally we go to the worst place and think it's going to be the worst result. So, but I think making sure that even I have some employees and I have to remind them, please cover your nose. Please cover your nose.
I know exactly what you're talking about, Elise. So the nose must be covered as well. That's the mask has to cover the nose and the mouth, right? Okay. So do we need to take any extra supplements now? Any vitamins you can recommend that we need to take, Dr. Moraney?
Well, okay, from Dr. Anthony Fauci, megadose vitamin C really helps. That's what I've been taking. And I'm not gonna lie, I've been taking my vitamin C faithfully every day. I'm trying to boost my immune system, but it is also trying to keep your, be in good health, exercise, sleep when you need to sleep, get that a good amount of sleep. Eat healthy, so you're trying to keep your body in optimal shape. You want to, you want to be healthy and, be able to fight off any germs that may invade your body. That's what it is. That's what it's all about. So, going back to that old fashioned, let's eat, good healthy meals. Let's get plenty of exercise a day. Let's get plenty of sleep. Those are things that we need to just restore our bodies and help our immune system to be strong.
Now, do you think there's something that the state of Tennessee could have done more of to help us with the virus? Anyone?
Can you repeat that, Ms.
Do
Johnson?
you think that the state of Tennessee could have done something more to help us with the virus? And I'm speaking in terms of the Lee administration. Do you think we could have done more to help?
Well, this is going to be totally
Early
opinion.
on when
Wait a minute,
Go
Andre.
ahead, Doc. I was just saying it's going to be totally opinionated because of the fact of our current administration, as far as we know it. They did not have the information given to the whole 50 states. So I think we were behind the ball before we even knew the enough information on. So we actually were playing catch up in some aspects of it. And I think we lost lives when we got real serious with it. So I think the state, as well as all the states, were behind as it relates to a country. That's opinion. That's simply opinion for me.
Yeah. I feel like the pressure on the governor financially to open things back up for the economy, personally, I feel like we should have stayed closed longer. I just think it was too soon. I think it kind of gave people the idea it's really not that bad. You can go ahead and go do. And I would have personally felt better had we stayed shut, had it mandatory to stay closed longer.
Until we kind of get it a little more contained.
But that's not how that's
right. So we just have to deal with it. And so many of you know that both of my parents and my brother, and David, my son, all had COVID at the same time. And I tell you, I just felt like my world was turned upside down. We did not know my parents had it. Their caregivers had it, so they were no longer able to come in and help take care of my parents. So David and I moved in with my parents. When I moved in, my brother came over and took his temperature, and we saw he had a low grade. So we said, get out immediately. Don't come back until you have been quarantined. And I'll never forget the night my mom was just so sleepy. She could not walk from one end of the house to the next without stopping and resting. And every time she sat down, she would just go to sleep. And I said, Mommy, are you staying up late? She loves to watch Westerns. I said, Mom, are you staying up late watching Westerns all night? Why are you so sleepy? We had no idea it was COVID. And so that night she got in the bed, and my dad was in the bed, so they're both all tucked in. And then my mom screamed, come here, something is wrong. And I ran to the room, and she said, something is wrong with my heart. And she looked so tired. And I said, well, just sit down for a minute. And when she sat down, she just became like, she just went over. And I ran I called 911 because I couldn't wake her up. I kept going, Mama, wake up. What's going on? Called 911. Then I ran and got Dave. And I ran and said to Dave, I think Mima has had a heart attack. Come and help me because I'm still not thinking COVID. And she said, my heart. And so he ran and he was just holding her. And we think that maybe when David could have gotten it again because she didn't have a mask on. And I doubt if David had a mask on. We weren't thinking about masks at that time. Even though we always wore masks around them. Whenever we came to the house, we always wore masks. But that night, after that happened, Dave was just holding her. So we called 911. They came in, they checked her out, and they said, we really don't like the way your mom is looking. She needs to be airlifted to the nearest hospital. And I said, oh, okay. And so they took her to Jackson. Well, I headed to Jackson, still thinking it was a heart attack. I even beat the helicopter getting there. And I go in and I'm like, yes, my mom, Cynthia Bond, is coming in. And they said, well, we don't even have her yet. And they said, has she been tested for COVID? I said, well, yes. As a matter of fact, I just took her today. She and my dad both were tested that day, but of course we didn't have the results. And they said, well, you can't come in. And I said, but I don't, it may be a heart condition. What do you mean? And she says, well, if you don't know if your mom is positive or not, you cannot come in. And Tina, you may understand all of this. And so I sat out in the parking lot for the longest, waiting for my mom to get there. And my husband was just getting off work, and he said, why don't you try to go home and get some rest, and then you can come back over when you find out you can come in and be with your mom. So I drove back to Brownsville, and they called me at 3:00 that morning and said, are you still sitting in the parking lot? I said, no, I'm at home. What's going on? They said, we're glad you're not, because you still can't come in because your mom is positive. Mm-hmm. And I said, what? She has COVID? And so my mom is 86 years old. She has some underlying medical conditions. And so I kind of was thinking, oh my goodness. Okay. And they immediately had to put her on oxygen. They gave her fluids. She was in the ER for a while. And then they said, we're going to admit her. She was in ICU for several days. And you all have to know my mom and her personality. When she began she says, oh, everybody is just so wonderful over here. I just love ICU. And we were going like, what? And so we knew then she was feeling better. Okay, she was feeling better. And she said, they're just so attentive. And everybody has been so wonderful here at the hospital. But I got a call, and maybe you medical professionals can help me with this. They asked about giving her plasma. And she didn't know, like, what should I do? And we said yes. And so they had a plasma infusion for my mom. And it appeared that is when she began to feel better and really come back around to somewhat of her normal self. Tina?
Yeah, we've seen that the use of convalescent plasma.
Okay.
So that is plasma that people who have had COVID have donated. And then we've also seen the use of a drug called remdesivir be successful. And so our, throughout the pandemic, there's been a couple different things. There's a lot of other drugs that we give and things we give, but those are the two main things that are just COVID related that we have in that toolbox to help treat our patients. And I'm so thankful that she responded to those treatments.
She did. And so when is that administered to people? Who gets plasma and who doesn't?
Okay. So at the beginning of the pandemic, we were part of a clinical trial. Our infectious disease physicians were part of a clinical trial with the Mayo Clinic out of Rochester. And they had specific guidelines of when the patient would qualify for convalescent plasma or not. Now, as the pandemic has progressed, those clinical trials have turned into something that we've had the use of convalescent plasma approved for use. And so we're not having to go through a clinical trial any longer. It's something that our physicians, based on the clinical condition of the patient, can prescribe and can order. And so we would encourage people who have had COVID, please, at the appropriate time, as directed by your physician, give that blood so we can get that plasma. And then on remdesivir, it's all evolved through about when we give it. The Tennessee Department of Health has just recently updated guidelines and loosened those guidelines a little bit on who we give it remdesivir to. So if someone's in the hospital, like your mother was, and they're having trouble breathing, they're requiring that oxygen, and it's within a certain number of days since those symptoms have started. It's indicated, and it's we're having some good results out of that medicine administration with the plasma. So it does evolve the guidelines. I would definitely defer. Dr. Murray, you may know a lot more about those specific clinical indicators of when to administer those medications.
Okay. All righty.
Yeah.
So to our three panelists who've had it's a good idea for them to go and donate their plasma.
Of course, of course.
Okay.
If you've had COVID and then you have been able to fight off the infection, it is very good to donate your plasma. Very good. I suggest that.
And is that just a regular, what is it? Where do you go? Where's your blood banks in Jackson? Just go to any facility there? Do you have to come to the hospital, your doctor? Where would you do it?
Lifeline Blood Services has been doing that. They'll do that blood. They need the blood. We just did a blood drive at our Jackson Hospital today. So there's a blood shortage. We always need the convalescent plasma. So Lifeline Blood Services is where I would.
I think they were in town a few days ago. I saw their bus in town, but I didn't think about it because I thought, well, I may still, they told me it'd be several months before I would be, test negative. So I was thinking, I don't know if they really want my blood, but they need that.
Mm-hmm. So when is it the best time for them to donate it? Do they need to be tested prior to going to make sure they're negative, or do they need to wait 3 months? What is the time frame of donating the blood?
Well, I'm not quite sure on that myself, so that's something that I have to research. But
okay.
I would guess about 4 to 8 weeks after the COVID, because that's when you start to see the antibodies, the IgG, and that's something that like 2 weeks after COVID, you will see what we call the IgM antibodies being formed, but those are the most, M for me, most recent, and then G, gone away. IgG, when you start to see those antibodies, those are the antibodies that that our bodies produce to fight off an infection. So when you see that, we know that the infection is gone, and you have those good, strong antibodies. And when you see that in the blood, and like I said, about 4 to 8 weeks, that's when I think that would be the time that you give that donate your plasma, so that you give that convalescent plasma. But about 4 to 8 weeks.
Okay. Well, listen, does anyone else have anything they would like to share at this time before we close out? You think we've covered it all tonight? Thank you all so much for. Huh?
I said you've covered quite a lot.
Okay. Yes, David.
I think I forgot one thing when I was speaking about my experience. Can you hear me?
Yes.
I failed to mention that when I first got tested for COVID, I tested negative, even though I was still feeling symptoms. And I guess because I thought I had the negative test, I thought I was still fine, but I still felt funny. I still felt like I didn't need to be around people. Okay. So I went and got tested a second time, and that's when the test came back positive. So a test could potentially come back negative. At least in my case, it did. So even if you still feel funny, I think it's still safe to wear that mask and keep your distance.
Right.
Oh, thank you.
I'm glad you said that. Let me speak on that, because that's where you have that window of time when you're exposed to the virus and when you test positive. And that's where they come up with that 14-day window. Mm-hmm. That 2 weeks before you actually test positive, your body could be developing COVID, but you don't have enough of the viral load so that you can test positive. So you'll come up with that negative test. But that's why it was so important when we as professionals would say, please, if you're feeling, sick, an onset of some type of illness or sickness, or if you have that cough, even though if you go and get that test, because people were using that test to kind of test out of being quarantined. So it's like, okay, I was negative, and then they're still around town doing things. They're still going to, stores, or if there is a gathering, and they're letting their guards down. They're not in a mask. They're like, okay, but I was negative. But you are developing COVID, and you're spraying particles everywhere. So now you're affecting other people until, like he said, he went back for the second test, and lo and behold, he's positive now. But during that time period where he, had the first symptom, if he went around town, he is spreading COVID. So now this one person affects another person who's going to go out and affect 3 more people, and that's how it perpetuates. So then those people affect 5 more people, and one from that group is going out and infect. And that's how, that's why we didn't get a handle on it early on, because we were kind of fooling ourselves thinking that we're going to allow people to make up their own minds about staying and not going anywhere, when if we would have just said, look, shut it down, we're going to close, we're going to wait until everybody, until we get this the virus in a community, what we call flatten the curve, until we get that flattened. We didn't really need to be out and have, people making their own minds to, I'm sorry, we allow a lot of people to be able to make their own choice about how they're going to govern themselves, when you even if you have a small amount of people, small number of people to say, I didn't want to wear the mask, that small amount of people can still potentially cause a wildfire. You know what I'm saying? And that's what really happened.
Okay.
And that, well, okay, I'm gonna tone it down, but that's what happened.
Well,
Amen.
well, so we are, so thank you for that. And as I always tell people, listen to the experts, listen to the doctors and those in the medical field, not politicians. Listen to the experts, those who have done the research. And if they are saying to wear masks, wearing masks will help to slow the spread, let's just do that. Let's just try it and see if we can get this virus contained, because don't we all want to get back to the way we used to live? I mean, I'm already thinking about now, I'd like to go when we're not shut down here, just thinking about vacations and, flying somewhere and doing different things. So I know we're all looking forward to that. Does anybody else have anything else they want to share with us tonight before we close out?
Andrea, I noticed one question was about the tracing, and from the health department.
I can't see that. Okay. Contact tracing.
I had a lot of conversation, a lot of phone calls from the time I tested positive, and they did, I thought, an excellent job. They counted me back 3 days from my first symptoms. I told them everybody that I had been around that particular day, and the young lady that I work with was one of the people. And so then we talked about people in the household that I could have caused taking the virus to them. And then they did call me. I'm sure they did. I mean, I'm sure the other people, everybody that came back positive, they would call from Nashville and check and see, how do you feel today? Are your symptoms worse? Are your symptoms better? And then they finally they said, okay, you're quarantined. You've had this many days with no symptoms, and you've fulfilled your quarantine. So, I mean, they did, it wasn't like, okay, you're positive. I didn't have to go to the doctor, and I never felt like I was on my own, because they called me every day to check how I felt. Did I have, was my chest hurting? I didn't have a cough at all until like the last day of my quarantine. But I was impressed that the state health department kept up with, my case, and with my coworkers' case as well as they did.
Okay. Oh, that's great. I'm glad you mentioned that because that is important. We need to let them know the people that we've been around.
Right. So that they called my other employees and said, have you had any symptoms? You need to be tested. You
Right.
don't, let them know you don't have to have a test if you were not around her on Saturday. The day she's contagious would have been, they counted back and said the day these two were contagious. If you were not at work, you're okay. Just stay in for 14 days. So they all had to quarantine, even if they didn't have to, the ones that didn't test, they still had to stay in for 14 days because we had worked closely. But the
Because
health,
they were exposed.
we gave phone numbers to the other employees, and they handled all of that. They let them know these two have been positive, and we need to know, have you got any symptoms?
Okay. And this is a good question. I'm glad you brought that up, Elise. If you have been exposed and they are saying that you need to be in quarantine,
Mm-hmm.
does that mean you should not leave your house for any reason?
Well,
can you leave home with a mask on, even though now you don't have symptoms? But David did. I mean, David had it. I was around David. Do I have to stay in and avoid everybody? Can I go to the grocery store with the mask on? What do you think, Dr. Mulroney?
I mean, quarantine is quarantine. It doesn't mean you get out and do what you want to do. You have to stay home. I mean, that's kind of how it is. That's kind of how
you need to stay in, right? So if you've been exposed, if you've been around that person, you need to stay in 14 days also, correct?
That's correct. That's correct.
Yeah.
Okay.
That's
All right.
what that means.
Just making sure you did not hear that from me. You heard that from Dr. Mulroney. Saying that.
That's right.
Okay. All right. So listen, guys, thank you so very much for sharing all of this information. I hope and pray it will help someone to understand the virus. And my heart goes out to all of the families who've been affected by the virus. And I am praying that we will have a cure, a vaccine very, very soon. Pastor Johnson, would you give us the honors of giving us a prayer tonight on behalf of all of those who've been affected by the virus to close us out? Thank you all.
Thank you for this opportunity as well. So, Heavenly Father, we are certainly thankful and grateful for this time and space that you allow us to be in. And Father, we know that this pandemic has not surprised you at any point, God. It's affecting us in so many different areas, and that's the reason why we call upon you for your guidance. We call upon you, God, for your strength and for the wisdom that you give to all of those people who are working close and up close with the patients and with the knowledge. We thank you for all of our doctors and nurses and our healthcare facilities and those who treat and those who come in contact with people and those who help people every single day. And Father, we pray for these families that have been affected by the COVID-19, even the loss of loved ones, God, even in this time. And Father, we ask your blessings upon us. And God, as we continue to fight this pandemic and as we continue to educate during this season and time that we're in, we pray now, God, that you would give us wisdom, and God, give the people who are in the labs and in the science labs to whatever vaccine they come, let it be for the betterment of our body and not to affect it more. God, give them wisdom. Help us to be patient in this time, because God, you're teaching us a lot as we grow and know and being able to embrace our family even more. God, help us to bring the positive things out of it and not all the negative. God, bless this broadcast tonight. God, we thank you for this information that was shared tonight, and we thank you for all those who behind the scenes making this happen tonight. In Jesus' name we pray. Amen.
Amen. Thank you all. Thank you so much for joining us. You all have a good night, and remember to please mask up. Good night, everybody.
Good night.
Good night.
Good night.
Good night.